Welcome back. A mysterious illness that's infected hundreds of people in China has now spread to the U.S. The CDC says a Washington man in his 30s recently traveled to the region in China where the coronavirus originated. He's under isolation, not considered a threat to the public. Several mainland airports are screening passengers from China for signs of the illness. Hawaii airports not screening, but local officials say they do check passengers for signs of illness and are monitoring the situation closely. Let's get a Hawaii doctor's perspective on this. We have Dr. Rupi joining us in studio. I know you have a busy schedule. Thank you so much for talking to us.
Thank you for having me.
Okay, coronavirus, not something we hear very often, Doc. So what should people know about this?
So the coronavirus is a group of viruses that are in many different forms, some of which can infect humans, some of which infect only animals. What's happened here is there's a type of coronavirus that's gone from infecting animals to now infecting humans. This becomes a potentially public threat. That's what's so concerning and why it's being taken so seriously. Now, there's a couple of things about this coronavirus. We don't know a whole lot about it. When it starts to infect humans, and it hasn't before, we don't know things like how quickly does it transmit from person to person, which we do know that there is human-to-human transmission that's taking place. We also don't know how quickly it'll spread or how severe those symptoms might be. So these are all questions that we need the answers to. We're hoping to get these in the next couple of days. We'll also probably get answers to, do we have a treatment for this? And are there vaccines available to help prevent this?
I can imagine that health officials worldwide are definitely trying to scramble to figure out what's going on.
Absolutely.
The last time, Dr. Rupi, that I recall something of this caliber of people being quite alarmed with the virus was SARS and Ebola.
So SARS is actually in the same family of viruses as this coronavirus. So it is fairly similar, and that's why it's being taken so seriously.
What are these symptoms that people...
So they're the typical symptoms of an upper respiratory illness, so cough, feeling unwell. It's actually fairly similar to flu-like symptoms, and so just looking out for those symptoms, fevers, these are the things that it can start with. Now, when it gets worse or potentially gets worse, people can develop pneumonia and complications from pneumonia.
So we do know that mainland airports are screening passengers coming from Wuhan, China, where it originated. But I'd like to get your perspective on this. Should we be doing the same here in the islands?
So I think it's important to take note, not to be alarmist here. We don't know much about this virus quite yet, but it is very important that we're aware of it and we know that this is happening. Now, obviously, we're in Hawaii. It's a tourist destination. We have people from all over the world coming into Hawaii. So I think it's really important that we follow what's happening and decide from there. Hopefully, we'll get some direction. I know the WHO is having an emergency meeting tomorrow to discuss. Wow. So we should get some direction as far as what exactly is happening and how big this threat actually is.
So the World Health Organization trying to get to the bottom of this. Well, we know that this is mysterious. We do know that it has killed a few people. So Dr. Rupi, how can we protect ourselves from this mysterious coronavirus?
So I recommend taking the precautions that you would for any respiratory illness. Now, just the basics, hand washing. So hand washing, it sounds really simple, but actually most folks don't do it properly. 20 seconds of soap and water. So 20 seconds, that's singing happy birthday to yourself twice in your head. The last time you probably saw somebody in a public restroom that actually took the 20 seconds to wash their hands was probably not recent.
I have never heard anyone sing happy birthday washing their hands, so you should definitely start doing that.
Yes, so washing hands is the first start. If you don't have access to soap and water, using hand sanitizer or alcohol gel, making sure that you're avoiding touching your face, your eyes, your nose, your mouth. Those are all portals of entry, so you want to be careful about touching your face, especially when you're in public and touching public surfaces.
Got it.
If you are sick, and this is a point that I really want to stress.
Stay home.
Stay home.
Stay home.
And cover that cough. So covering your cough is not this. This does very, very little.
I do this, no?
Exactly, no.
You have to go like this?
Well, you don't want to really use your hands because then you're going to use those hands to touch a doorknob.
Right.
You're going to use those hands to touch a keyboard or other things that other people might touch and get infected by. So you want to cough into the crook of your elbow. And if you don't do that, then maybe use a tissue and make sure to throw it away.
Dr. Rupi, all great information. We're going to definitely put this up on our website, guys. Make sure you sing happy birthday when you're washing your hands. Lauren, over to you.